Well, hello, everybody. Welcome to the Healthy Joints, Healthy Lifestyle Show. For those who don't know me, my name is Dr. Arinola Dada, and I help people with joint pain become pain free and people with autoimmune diseases get their immune system back on track. And guess who I have for you today? My dearest friend, Dr. Anita Lwanga. And Dr. Anita Lwanga, welcome to the show. And you've been here before.
Yes, thank you so much for having me on your show. I really enjoyed talking with you, and I'm excited to, share my knowledge with your audience again.
Thank you so much for coming. So, I'm going to tell the audience a little bit about you, and then I'm going to have you tell us why you do what you do. So, for those who don't remember, Dr. Anita Wanga is an exercise physiologist. Boom. General internist, boom. Geriatrician. And she attended St. Matthew's University School of Medicine, did residency at Mount Si, and geriatric fellowship just to top it up at the University of Illinois in Chicago. And she helps people with chronic medical problems optimize their diet, sleep, and medication. Thank you very much, because we need that. So Dr. Wanga, tell us, why do you do what makes you so passionate? She is one of the most passionate docs that I know. And tell what makes you so passionate about what you do? Why do you do what you do?
That's a great question. To begin with, my background, even before medical school, I was an athlete. I was a competitive gymnast, and I'd actually experiment on myself. I'd experiment with sleep, experiment with what I ate. And in terms of going into medicine, I had injuries and I couldn't find a sports medicine physician locally. So I was like, I'm going to grow up and I'm going to become a sports medicine doctor. And life had some slightly different turns for me, and I didn't end up doing sports medicine. But I did my first degree before I got into medical school in exercise and health physiology. Basically, we study how exercise impacts the body. And it's so interesting because a lot of the information I learned at that time is still relevant today. Although the research has changed and the way they do things have changed, the information is still relevant. Exercise is a very powerful tool we can use to improve our health. Our diet is extremely important, and even our sleep is extremely important in terms of improving our health. So I did exercise and health physiology and then eventually went into med school. And, here I am now today, still pulling on what I learned as an athlete and as an exercise and health physiology to help my patients today.
Wow, I never knew that you were a gymnast. Wow. Okay. That explains so much about you, the discipline, the focus. Okay, girl. Okay.
I guess I guess my parents' investment did not go to waste.
No, no, not at all. No, no, not at all. I'm sure they are very proud. So, we wanted to talk today a little bit about, effective weight loss strategies, especially when we're thinking about our joints, right? And how do you do it? Because a lot of my patients, for instance, people have told them go exercise, but my joints hurt. Right. So, what do you feel are kind of, especially with your background, right, as a gymnast who's experienced a lot of this, what do you think are one of the most sustainable and joint-friendly ways to kind of lose weight without causing further injury or pain?
I love that question. The main reason being is that the answer is not going to be what most people expect it to be. Definitely, when we think about losing weight, a lot of us think that I have to exercise and I have to exercise hard and hustle hard. And when you're having joint pain, you don't want to hustle hard, you don't want to exercise hard. You have enough problems even just walking around and doing your daily activities. And
Mm.
it seems like an impossible battle, but it's not. So I think the main secret to weight loss, first of all, is the diet. It's not the exercising, it's the diet. And many personal trainers will tell you 90% of the results are based on what you eat. So you can exercise your heart out. If you're going to eat cookies, McDonald's, things that are not necessarily the best for you can work out, you might have some results, but you're not going to achieve your goals. So if you're an individual, say, who has very severe joint pain, you're on the wait list for surgery, um, you can walk around the house, but you can't do long walks. Start by focusing on your diet. So going back to the diet, how can you change your diet in a way that's not too complicated? Number one, look at what you're eating and try to make it natural. For example, if you eat cereal, favorite one, cereal for breakfast. Cereal did not grow or come out of the ground that way. Think, what can I replace this cereal with that came out of the ground that doesn't have a lot of sugar? So we have a lot of choices. You could do something like an omelet and put more egg whites in it and put more vegetables. If you like toast, you can do avocado toast. At least the avocado is natural. It came from the ground that way. So you take small steps and modify what you're eating to be more plant-based and more natural. When you're selecting meats, say for example, if you have bacon at breakfast, if that's your thing, maybe switch to lean turkey bacon. Or it doesn't hurt to eat the lean meat you ate for dinner last night. Nobody says that whatever you ate for dinner has to be only for dinner. You could use it if it's like a nice lean piece of steak or lean piece of chicken and make that your breakfast instead. So focus on natural foods. Try and increase your protein intake. Try and increase your fiber intake. And then cut back on processed foods and simple carbohydrates.
Yeah. Yeah, so I'm actually making some notes as you're speaking, right? Because one of the things that you mentioned, first of all, is just that you cannot outrun a bad diet, right? So you cannot out exercise, a bad diet. And so, really coming to if the point is to lose weight, then really kind of focusing on the diet. And I remember way back, I just used to feel, I mean, I've never been a junk eater anyway, but I like volume.
Me too.
So yeah, so I don't eat junk, but give me my steak and give me my rice and let me chow down. And
Mhm.
so and so I did, and I used to when I was younger, I used to run. And when you run in your 20s and you run in your 50s, I mean, there's a whole different that's when you really realize as you get more mature and dealing with all kinds of aches and sprains and stuff that you really can't outrun that bad diet. And so, at this age, I think you and I have had those conversations about, the diet and thank you so much for emphasizing that nothing says that you can't eat what you had for dinner for the next morning. Because people kind of think, I think it's a marketing for cereals that you feel like you need to have a cereal for breakfast and that breakfast food has to be so different. And because people don't have time to cook in the morning, so there's always that tendency to grab something out of the box real quick. Right. And the marketing has told us that you can just grab something out of the box. So I heard you say that cereal did not come out of the ground. Right. And
Last I heard.
yeah, so cereal did not come out of the ground. And then you went on to kind of explain that that we're looking for non-processed foods. Can you talk about that a little bit?
All right, so non-processed foods, a very simple way to think about it is when you're walking in the grocery store, the way most grocery stores are set up, the natural foods are on the peripheries and then the processed foods are on the inside. So natural foods are things that came out of the ground that way. Either I had heard somebody say, does it fly? Does it walk? Does it swim? Or did it grow that way? So when you enter in the grocery store, most of them, you'll see the fruits and the vegetables. Most of them came out of the ground that way. So most of them are pretty safe to choose in terms of healthy foods. The milk, it's a little bit modified, but it's still natural for the most part if you're going for animal sources of milk. Plant-based milk, then that's not really close to its natural source. Bread is not in its natural form, but oats are in their natural, well, pretty close. They have to do some processing. If you're looking at your rice, your brown rice is pretty close. They take it off of the husk, but the white rice, they've taken the husk off. So if you have those two options, it's probably better to choose brown rice. And then your meats. If you have a piece of steak, try choose steak that has less marbling. That same with other steak that is maybe not so lean. Both of those are natural forms, but if you compare it to luncheon meat, they have to do a lot of things to make that luncheon meat. They add salt, they add preservatives. So definitely lean towards your meats that are more natural. And
Yeah.
animal fat, even though animal fat is natural, it's not necessarily the most healthy form of fat for us. So try to lean towards meat that is lean. Salmon actually has fat on it, even if it has fat on it. That type of fat is good for us. It has more omega-3 fatty acids. So just try to, think to yourself, is this close to its natural form, or did humans have to do a bunch of stuff to, make it what it is today? And try to reduce the amount of things that have been modified by people and select things that are natural.
Yeah, I think that's a good way to kind of look at it. So even sometimes you think that you're eating something healthy, a lot of people are vegetarians, right? And you're like, okay, I'm a vegetarian, I'm off the hook. But, there are a lot of non-healthy vegetarian options, right? That
Too
comes in,
many.
yeah, comes in boxes and preservatives. And in my world, preservatives also cause inflammation too. So we try to tell people exactly what you're saying, just to reiterate that the more organic, the more closer to its original form in food is, the less likely it's going to create an inflammatory process that may even prevent weight loss. So it's kind of all kind of just this whole, they all kind of come together. So just reiterating exactly what you're saying. So, we kind of talked about diets a little bit. Any more thoughts about any specific diets that can help with weight loss and reducing kind of the inflammation in the joints? We kind of went there a little bit.
Yes, I love that question. So, definitely anti-inflammatory diets are a trending thing right now, whether you have
Yes.
joint problems or other medical problems. I think
Mm,
if somebody really wants to focus on a diet that reduces inflammation or anti-inflammatory diet, the
mm,
best first step I'd tell them is try and find a nutritionist because there's a lot of information out there and the research keeps on changing, but try and find a nutritionist. In terms of simple tips I can offer right now, food that is in its natural form, which we previously talked about, causes less inflammation in the body. The reason that this happens is because there's less preservatives, less chemicals added to it. So your body does not have to work as hard to manage all these chemicals. If you want to boost the anti inflammatory properties of, say, your diet, spices. Spices are a great way to do this. So, for example, if you're going to make yourself a steak, put something like turmeric on it, and you can supercharge the efficacy of turmeric or the way your body absorbs the turmeric by adding pepper. And then you can add some other spices to it, but try and add spices that are, not too processed. For example, a lot of us go to Costco and they have these big packages of spices. If you read the container, you're going to see, okay, turmeric, cumin,
Oh, I
paprika.
lost you a little bit. I think we have
Oh,
someone. Oh, sorry, I lost you a little bit.
mm-hmm.
But yeah, sorry, I lost you a little bit. And okay, I don't know if it may be you or me. I'm not sure which one of us is a little unstable. Can you hear me okay?
Oh, yes, I can hear you.
Okay,
Okay.
perfect. Okay, so can you go back to that turmeric and black pepper?
Yes, yes. So if you're
Yes.
gonna get a steak, a lot of
Mm.
spices have anti-inflammatory properties in them. They have all these things called phytochemicals, which in simple terms are good for your body. They reduce the risk of cancer and they just give your body different nutrients beyond the vitamins and minerals that your body needs to do well. So, for example, if you're gonna make your steak, you can put turmeric on it and then you can add pepper. And the pepper increases your body's ability to absorb the good nutrients from the turmeric by I think it's 1,000 fold. If you're
Wow.
going to have oatmeal, you can use cinnamon. There are studies that show cinnamon actually lowers your blood sugar and it can reduce inflammation in your body. If you're going to have tea, why not take some ginger and add it to your tea? Ginger has actually been shown to improve digestion and it has components in it that are very similar to turmeric. And a tip when choosing your spices, a lot of us go to Costco and we find these big, supercharged containers, Montreal steaks, spices, chicken, blah, 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 and they have extra words on it. This chicken tiki masala thing. That's okay, but ideally, it's better to choose the spices alone in their powdered form because when you look at those little containers from Costco or XYZ spice mix, they'll have all the good stuff in it. And then as you're going to the bottom, you're going to read monosodium alphabet soup, all these funny, funny things. So they're pretty,
Alphabet soup.
yeah, they put all these letters. If you can't pronounce it, that's like maybe okay, coumarin and turmeric, those are a little exotic. But if you're seeing like too many words that look like weird, those are chemicals.
Yeah.
So avoid those spices. Choose your own
Mm,
spices. You can look
mm.
online and try to make recipes, or if you have friends from a different country, ask them what spices do you use. Can you tell me a recipe? And most times, people from developing countries, when they have their own recipe for say chicken tikka masala or jerk chicken, they're not going to use the bottled jar stuff in the store. They're going to tell you this is how my grandma made it. She puts this,
Yes.
that, and you can modify it. If they're putting
Mm.
sugar in the jerk chicken, you can reduce your sugar, but the other spices that they're putting in it, and then you can make it your own, but use real spices as well as much as possible. Powdered spices are okay, but make sure that they're not adding extra stuff to your spices. So that's my take on an
Yeah.
anti-inflammatory diet.
Yeah. That totally makes sense. Thank you so much for that. And yeah, because and especially when you talk about sugar, sugar is pro-inflammatory. And so yeah, so trying to make sure that when you're looking at recipes that you're cutting that out. And totally love your emphasis on turmeric. Actually was reading the other day about, and when you mentioned black pepper, I was like, ah, because I think there was an article in one of our rheumatology journals where they talked about the benefits of turmeric and how you can boost it, just like you said, with black pepper. And they were actually using it for like pre and post exercise recovery. That you could, that having the black pepper would help with the muscle recovery, and that you could drink that pre and post exercise in your little drink. Hopefully, it doesn't have a lot of sugar in there, and that would really help post exercise recovery. So I was so excited when you mentioned that with black pepper. Cool. Okay. Next question. What are the best low impact exercises for weight loss, but also support kind of bone health? We're trying to get it all.
That's a great question. And it's, I think the number one simple one, if you can do it, is just walk.
Yeah.
Most of us can walk. If, you know, even if you have joint pain, you can walk a little bit. And there's ways to make it more sustainable. For example, if you go for a slow walk, it doesn't have to be even a brisk walk. You walk slowly for 1 hour. Maybe go on your treadmill, find your favorite TV show, and walk slowly. 1 hour will go by very quickly. And if you can do this walk first thing in the morning, as long as you don't have medical problems that will preclude you from doing that. For example, some of my patients that have diabetes, maybe doing a walk on an empty stomach, you have to be a little bit careful depending on the medications you're taking. But for most individuals, if you walk first thing in the morning for 1 hour, slowly, if you really want to maximize fat burning, push it to an hour and 15 minutes, an hour and a half, maybe 3 days per week. That's it's a commitment, I agree, but it's a commitment that will pay dividends. If you're somebody who doesn't have access to a treadmill or you can't even walk, you can look into something like aquasize if there's a pool close by. You'll burn a lot of calories with aquasize. It's removing all the stress and weight from your joints, and you're still going to burn a lot of calories. If you can't do any of these activities, you can do something even as simple as getting yourself one of those little pedometers for the arms. You can do arm exercises, or even same thing, you can get the pedometers for your feet. So if you're sitting down, your wheelchair, well, maybe a wheelchair bound even, or you can't walk very far distances, you can still do the exercises where you're pedaling while sitting stationary, and you can do that while watching TV. Some people do it while working. It depends on if you can multitask like that and you're coordinated, that's great. But it doesn't have to be a big commitment, and slowly increase the time you're doing it. But if you're doing something that's low impact, just do it for a longer period of time and you'll still find benefits.
I love that, because, you can imagine when people are, limited in their ambulation, there's almost a sense of, I guess I can't do anything anymore, right? And so this tells you, no, you can actually, and you can still keep your muscle toned. The idea of having something for your arm where you're doing the arm exercises, and you still have a body that you need to keep toned, and so you can still, keep your muscle strength, right? And you can still do exercises with your legs, depending on, where your issues are. You can work on the other parts of your body. So we don't give up. We keep going despite whatever limitations we may have. So thank you so much for kind of giving that kind of inspiration to people who kind of are struggling, but it's also good for them to know that, hey, I may still have options, because I do have a lot of patients say, I used to run, I used to be a runner. I hear that all the time. I used to be a runner and then now I don't do anything. But thank you for giving us kind of just other options, including the aqua therapy, right? I love the water exercises though, as you said, because that's really very low impact. It's just with us, sometimes with our hair, with our
Yes.
hair in the water, you know, and most men don't understand us women and our hair, right? But it's like, I really want to put my hair in the water, but once you can get past that and figure out, everything is figure outable, right? Figure out how to make that work, then yes, I think the water therapy is also amazing. So next question for you, Doc. I think this was posted by a patient of ours, which is, how does muscle strength affect weight loss and joint pain relief?
Excellent, excellent question. So maybe I'll go back a little bit to the physiology, or in simple terms, the way our body kind of works. So we have the bones. So say for example, this is one of the longer bones, and there's another bone here that's separate. There are joints and ligaments connecting each bone to the next bone. So these, when the muscles are stronger, the ligaments also become stronger. So, for example, if you're having knee pain, one of the things that can cause knee pain is weaker muscles. So, if you try and work on your quadriceps muscles, which are the muscles on the front of your legs, the muscles on the back of your legs, and the gluteus muscles, or the as people call it, the bum in simple terms. If you can work on those muscles by doing squats, something as simple as squats, standing up and down, as those muscles get stronger, they're working hard, they're going to tell the ligaments that are connecting the knee, say this is my arm, but say the muscles here are going to tell the ligaments holding this together, become stronger, become more stable. And then over time, you'll notice that the pain actually goes away. Not for everyone, but this is a common occurrence. As people get stronger, the pain tends to go away. So if you're able to do exercises to strengthen your muscles, your ligaments will get stronger, the joint will become more stable. As it becomes more stable, the pain will also eventually go away. Does that kind of answer or fulfill the criteria to answer the question?
It does for sure, right? And we have that often with people with knee pain. I would say, actually, honestly, I'll share that I also had that issue with my knee. When I used to run like crazy, and then I did something to it, and then and then I developed this knee pain, and it wouldn't go away until I went to physical therapy, and and then I learned knee exercises that I now still use till date. This is, I think, years ago, and I still use those exercises today to kind of stabilize that knee because when there's all that movement, that's what causes the pain too. So having that firm knee where the ligaments and tendons are very strong actually helps to provide that support and prevents that friction which causes some of the pain. So I've totally lived what you're saying, and thank you for answering that question very thoroughly.
And
But
even sorry, I didn't mean to interrupt, but even going
yeah,
back to your days as a runner, you probably remember your coaches telling you to do conditioning exercises. Anybody
yes,
who's
they
an
did.
athlete will remember. They're like, why? Your coaches knew something. They're trying to avoid injury. So they'll make you do
Hmm.
this repetitive thing, standing up and down on your toes, squats, lunges, and they'll say, do it with proper technique. The reason
Yeah.
being is they're trying to stabilize those joints and ligaments so that when you're sprinting, your joints and ligaments are very strong and you're less likely to get injured. And any athlete who is probably a little rebellious knows when they skip their conditioning for a couple of months or after summer holidays, you came back, you're
Mm.
more likely to injure yourself.
Yeah, that's true.
So physio is almost like conditioning. And even in our day-to-day lives, we need those kind of strengthening or conditioning exercises to help us prevent injuries.
Definitely, definitely. Wow, we can go on, but I do want you to do one thing for me. Can you share a story about a patient who's had an amazing outcome after being in your care? I know there are plenty. You're gonna have to pick one.
Thank you for telling me to pick one. I was about to cheat. Um, so one in particular, cute lady, very, very cute lady, had a lot of joint pain. And I noticed her gait was like quite wobbly and she was always complaining, my knees hurt, my back hurts. And maybe not the best candidate for surgery because she had other, medical problems that would make it a bit more complicated. So as I was working with her, we were trying different medications, Tylenol, Voltaren gel, ibuprofen. She wasn't necessarily keen on doing injections or steroid injections. So a simple thing I told her was to get one of these bike pedometers where you sit at home and you just bike. I wasn't necessarily thinking about improving her gait or, her strength, but I'm like, she needs to keep moving because she doesn't get out much. And our winters in Canada are lovely, very cold.
Lovely.
So she got the pedometer and I hadn't seen her for a long time. Of course, in wintertime, she was like, I'm going to stay home. She came back several months later and I'm like, she's walking straight. I was shocked. She was not wobbling back and forth. She was smiling. She was not, when people are in pain, they have that pained look on their face.
Yeah.
She seemed like totally good walking. And I was like, what happened to you? She's like, the bike. I got that little stationary, not like a full bike, like the
Okay.
pedometer. And
Okay.
just that, her knee pain and back pain completely went away. I was very
Wow.
surprised, but that's the power of having your muscles, become stronger. For some
Yeah.
people, it means the difference in between living with pain all the time, taking more
Yeah.
medications,
Yeah.
and perhaps even going for surgery. So that's
Yes.
one story.
Yeah, that's amazing. That's amazing. And I think kudos to her, for also the commitment to it, right? Because it didn't happen on day one. So she was committed to that outcome and she got the results that she wanted. And I think that's something else. Some people say, oh, I went to PT, they gave me one exercise and that's it, right? It's the commitment that gets you the kind of results. And thank you for kind of mentoring her through that to actually help her to get the outcome that she deserved. So, well, it's great to have that partnership. So, she was very lucky to have you as her doctor, Dr. Wanga.
But you're right, she was also committed because I had not seen her for months. That small implementation is powerful.
Yeah. Okay. Well, I need to let people know how they can find you. So if they're local and in the area and want to work with you, please let us know how they can find you. I'm going to have your social media handles at the bottom of this talk, so it'll be there. But tell us how, if somebody wants to work with you, who's your ideal client and how do they find you to work with you?
All right, so as we mentioned before, I'm a general internist. I work at the Saskatchewan Health Authority. So the way patients can come and see me is if they get a referral from their family doctor. Our system is slightly different than in the US. You can't necessarily walk in and see a specialist. So if you have chronic medical problems, you are a geriatric patient or somebody that's 65 years and older, you have multiple medications and multiple medication, medication complications or multiple chronic problems, those are my ideal clients. So if your family doctor thinks it's appropriate, they're welcome to, send you my way, and I'd love to help you. We can talk about your medications, your diet, your sleep, and I will do my best to help you, get healthy and get better. So as I mentioned, in addition to mentioning them in the Saskatchewan Health Region, the specific city is called Regina. And for those of you who are not in Saskatchewan, which I suspect is most of your audience, if you're in the US and you want to hear more about how to improve your health, how to optimize your diet, your medications, I share a lot of my knowledge on YouTube. So you can go to YouTube and you can just type in Dr. Lwanga. I think we're releasing at least one long video per week and several shorter videos, and you can watch all of the old content and, learn a little bit more about how to improve your health and hopefully stay away from doctors and stay out of the hospital.
Stay out of the hospital. That's what you want to do, right? So thank you so much, Dr. Wanga. And so for everybody, thank you so much for listening. Dr. Wanga, I'm going to have you back some point, right? We have so much to talk about. You have so much knowledge to share with people. And I love the fact that your advice is very action oriented, like you. Your advice is very action oriented. So if any for our audience, if you think this video has been helpful people, like it, share it with your loved ones, anybody that you think is kind of struggling with this, and would love to have Dr. Wanga back on our show. Thank you, everybody, and have a wonderful rest of your day.